you.
So we're going to talk about migraine, right?
Right. And as you know, worldwide, headache is the second most common reason people see doctors or medical providers. And migraine, of course, is an illness that many people know about. A very severe headache, has a lot, people are unable to go to work, go in a dark, quiet room, and it really can be quite devastating.
Yes.
And when you treat migraine, there's two parts of it. There's the acute headache. So if somebody gets a migraine, unlikely they could get acupuncture then and there. However, to prevent headache, there are very, very good studies that show that acupuncture is even better than some of the medicines that I, as a physician, have been prescribing.
Yes.
The side effect profile is markedly better because you're not worried about this whole list of potential side effects from a medicine, an upset stomach, a cough, nausea, etc., etc. That doesn't happen with acupuncture. And they show that if a patient goes through a course of acupuncture to prevent future migraines, it cuts the frequency significantly, and that after that course, that benefit lasts. So it's not only while you're getting the acupuncture, but after the acupuncture, patients still receive the benefit. Now, I'm a family doc. I don't have your expertise for acupuncture, but I know, having done the reading, looking at the literature, this is a really worthwhile thing to recommend for a patient. Especially, I have a number of patients who are very sensitive to the medicines that we would use. Having had acupuncture from you, it's nothing. You feel nothing. Maybe when you put a little bit of a sensation, if there's a little bit of energy applied to the needle, but other than that, and if I'm going to get the benefit, why not?
Yes, I think for preventative reason, and so they can help improve the quality of life. And from your point of view, when people take medication for long term to prevent, they very often saying that they still get migraine.
Oh yeah, none of the preventative medicines are perfect.
That's right. So what's the mechanism? They block the nerves, or they
work in different ways. One of the first medicines was a drug called Inderal, propranolol is a chemical name, and that came out as a blood pressure medicine, interestingly enough, when it originally was released. And then it was shown in patients who had high blood pressure and migraine, the frequency was diminished, but it was never down to a really low frequency. So you would get a breakthrough migraine.
Yes.
And as you know, migraines can be triggered by a number of different triggers. Weather change for certain people. People have a food sensitivity that they're out eating and they didn't realize that a particular spice or food was what they were eating, and they trigger the migraine. Being overtired, working too long. For some people, they don't get active sleep, they get migraine. But the nice thing or feature of acupuncture, it's immaterial what your trigger is. If you go on a preventative course, it's going to work.
Yes, and usually there is a root cause to lead to frequent migraine, either hormones or the blood vessel inflammation. And I think medicine is very important. That when you have migraine, you cannot function.
But that's the acute treatment.
Yes,
the drug of
the
drug of choice is called sumatriptan worldwide.
Yes.
Very safe. But if you take too many sumatriptan, you get a rebound.
Yes.
And there's no rebound with acupuncture.
That's right. Yes.
Yeah, because you're doing it for different things.
Yes.
So for any patient that up to now that I would see with migraine, I say, okay, you're going to treat the headache. We'll get you better. But then, depending on the frequency of headaches, if you get one headache every 6 months, it's one thing. But there are people getting 3 migraines a week or more.
Yes.
These are the folks who could really benefit from a preventative treatment. And I can look up for some of the common medicines they're using. The side effects are significant, and the studies show that there basically are no side effects from acupuncture done by a professional.
Yes, yes. The only side effect may be the bruise.
A tiny
yeah.
bruise. And actually they did a study where they compared real acupuncture to sham acupuncture. In other words, the
Yes.
person getting the acupuncture and giving it didn't put the needles and use the proper technique. I, as a patient who's naive, wouldn't know the difference.
That's right.
But when they analyzed the results, the sham, no, they didn't get a benefit. The real acupuncture, they got a benefit.
Yes.
So it's been shown in a number of different studies to be very helpful for people who have migraine.
Yes, and so to treat the root cause of frequent migraine, I think combining acupuncture with the medicine, then in the future they can reduce the frequency.
Right.
And then you cited a bunch of clinical trial, which
Right.
is randomized clinical trial, and they have many review paper.
Right.
Yeah, so
And ideally, in my mind, if somebody can just use acupuncture, there's no side effects. If I put somebody on a medicine, some people don't have side effects for sure, but there's no way of knowing, and not many people keep what's a migraine diary, which is really important, especially if you're going to come to an acupuncturist. How often do I have my migraine, and how intense is it? Because if I say to somebody who's having migraines, the migraine history you had last Tuesday, how did it compare to the one you had the Friday before? Well, they'll remember they had the 2 headaches.
that's
They
right.
don't have the intensity. If they start doing that and they come to the acupuncturist, then and they keep that diary going, you can see the improvement over time.
That's right.
That you may initially reduce the intensity of the migraine,
That's
and
right.
then hopefully the frequency.
That's right.
And
That's right.
I mean, the ideal thing is not to need a preventive medicine. Some people would, and it's very safe to combine the two because
Yes.
there's no interaction from acupuncture to a medicine. When you add one medicine on top of another, because some people, not only are we going to be treating their migraine, they may
Yes.
have blood pressure, diabetes, arthritis.
Yes.
So you're adding a whole cocktail of medicine to somebody.
Yes.
Why not avoid that?
Exactly, and also it increased the burden of the kidney, right?
Oh, definitely the kidney, the liver, the GI tract, depending on the specific medicine and its side effects. So acupuncture, as you say, maybe a little bit of bruising. I've never had it. And so, yeah, I think it's a really important treatment for people to consider.
Yes.
And I believe, and there is some data of how often and how frequent, which is not my background, but you would know how often to treat a patient to get prevention from migraines.
Yes, and then that's a very good point because some people saying that, oh, I didn't get a good result, is because there is a sufficient dosage and frequency. And the study you showed me, the randomized clinical trial showed that 3 times a week for 12 treatment, and then they repeat that 24 visit altogether, and that will give the sufficient dosage.
Right.
Yeah.
And and that is no different than taking a pill every day, in the sense of you don't just take one pill and prevent it.
That's
You
right.
take ongoing medicine. You need a course of acupuncture to help. And I believe, and I'm not an expert, for most of the indications of acupuncture, I don't think there's one where you just go to one visit and the problem's solved.
Yes, exactly. Unless it's a muscle sprain,
Yeah.
and then the one treatment will have instantaneous result, but it's
Right.
still not healed completely.
Right.
So combining these two, just like you said, we can prevent the future frequent migraine.
Right.
But I want to ask you a question about the medication for preventative. Is that a beta blocker?
Okay.
Is it very common?
The first medicine that came out was a beta blocker.
Yes.
That was the first medication. And if just, I happen to have, just to make sure I'm not going to give incorrect information, if you look at the side effects, now Inderal is the company's name for the drug. Here we are, and it's called propranolol. These are the adverse reactions. So in other words, if you take this pill, what might happen to you? You can have a heart attack if you stop it. quickly. You can have trouble with your breathing, bronchospasm, trouble breathing.
Because it's a dilate.
It's
Yeah.
because it causes spasm in the lungs.
Okay.
It can cause a dermatitis. It can cause lupus,
Oh.
the condition. Those are the severe ones. The common reactions, what most people would have: fatigue, dizziness, constipation, low blood pressure, depression, insomnia, weakness, disorientation, nausea, diarrhea, and loss of hair, alopecia. Now, those are the common side effects. Now, that is a drug which I've prescribed many times. Those are the reported common side effects.
Okay.
There is no list like that for acupuncture.
Yes,
I
exactly.
mean, as you say, a little bit of bruising, and depending, some people really have a fear of needles, so that, that tiny little stick, which for some people is significant, that's it. I'm not worried about insomnia. I'm not worried about having a heart attack after you finish treating me.
Yes.
So that's just one of the classes. There are other medicines that we've used because migraine being so frequent, they look at what to do. But if acupuncture is available, and I'm not trying to sell this, but if it's available, much safer option.
Yes, we can combine that. How about amitriptyline? Is that
That's another preventative medicine, and just to give you the side effects.
Is that the blocking the nerve, amitriptyline?
Amitriptyline is, let's see here, amitriptyline is the generic of, it's indications: depression, neuropathic pain, migraine, prevention, but that is an off-label indication.
Okay.
By that I mean that the government, the FDA, says these are the indications for a drug that we approve.
Okay.
And migraine is not an approved. That doesn't mean people don't take it, because I can tell a patient or discuss with the patient, let's consider amitriptyline to prevent your migraine headaches. It's not approved. I will tell you about the drug, and if you agree, you're allowed to prescribe it.
Yes.
And so that's one of the off-use. It's also supposed to help with tension-type headaches, because we've been talking about migraine, but tension-type headaches.
Okay.
And another one is called fibromyalgia. It's also indicated for irritable bowel syndrome. So a lot of these drugs have a number of other uses which may be not as well studied or documented, but some people benefit.
Okay.
And if you have a patient where you're searching for help because you started with the initial medications and they haven't worked, you move on to the off-label, the other medications.
Yes. And amitriptyline, what's the common side effect for that?
Side effects, I will tell you the serious ones: low blood pressure, fainting, an irregular heartbeat. You can have a stroke, seizures, trouble with your gait, ataxia. It can even give you glaucoma, increased pressure in your eye. It can make you manic.
Oh, okay.
Become suicidal.
Oh, okay.
Hepatitis. So and there's a withdrawal syndrome.
Yes.
Many medicines you have to stop slowly. That's now those are the serious. The common: dizziness, constipation, blurred vision, palpitations, rapid heartbeat, impaired coordination, nausea, vomiting, weakness, disorientation, confusion, insomnia, anxiety.
Okay.
Again, this whole spectrum. Now, we may only be talking for some of them 1 person in 100 or 1 person in 200.
Yes.
But when you give a medicine to a patient, you don't know, and I have no easy way of knowing currently how they're going to react.
Yes.
Now, I know you can do some genetic studies, and you can look at their metabolism.
Yes.
And I mean, I always use myself as an example. Folic acid is an essential vitamin.
Yes.
I metabolize it a little differently, so I have to be on something called methylfolate. It's the folic acid it's methylated. They change it a little bit. It's an over-the-counter. It's not a prescription. So for me, if I just took folic acid, I'd have to take a lot more than just taking a small dose of this one, and it works. The same when you get to a patient, you don't know how much medicine they're going to need. You don't know if they're going to react to it. And we're not going to have everybody have genetic studies to look
Yes, how they responded.
how they're going to respond.
Uh-huh.
The typical procedure for a doc is to say, okay, here is the medicine, here's the potential problems. One thing I do, which is different than acupuncture, I always start everybody on a low dose.
Yes.
Because if you're going to have a side effect,
Exactly.
it's lessened. You don't worry about that with acupuncture.
Yes.
There's no low dose acupuncture that I know of.
Yes, yes. So if we can combine these two, we can keep the lowest possible dosage so that we can reduce the side effect.
Right. Oh, and personally, I would give I don't do the acupuncture, but if I was treating somebody with migraine, I'd say, okay, here's the medicine when you get the headache. That acupuncture is not going to treat if you wake up in the middle of the night and you have a
Yes,
headache.
you need a
But
medication.
Let's start the preventative treatment.
Yes, when
And
you don't have.
You started when you're off and you finished your headache, and go that course, the 3 times a week, the total of 12 weeks.
Yes.
Keep a diary. That's really important because sometimes it's hard to realize that you're improving.
Yes.
And when you assign a number for headache, I say go to between 1 and 5. My 1 for headache, if I was getting a headache, is always the same. It may be different than somebody else's 1 or 2.
That's right. Exactly.
But I'm consistent with how I gauge my headache.
Yes.
And then you can look back and say, gee, over the last few weeks, you've gone down from a 4 to a 3, and you've had some 2 headaches.
That's right.
It's an easy way of looking back
Yes.
and documenting that your acupuncture is working.
Exactly. Yes. So.
And then you keep the diary going afterwards and see how long, if it works as we hope, that you're headache free.
That's right. And then lower the medicine dosage.
And then ideally, if you just need the acupuncture, which it can work, and there's studies to show to prevent it. And then if you get a sudden breakthrough migraine, you've got the pill for that 1 episode.
Yes, that's the best way.
Right.
Thank you.
You're welcome.